Hi, everyone. My name is Zach Hardy, and I am the State Government Relations Officer at the Michael J. Fox Foundation for Parkinson's Research. And welcome to our second annual State of the States webinar. We are so excited for everyone who has joined us today, those new and our friends who have been with us in webinars before. Before we get started with today's official program, I just wanted to share a couple of housekeeping notes for all who are attending. As an attendee, you are in a one-way viewing experience. This setting is to make sure you're able to see and hear all the information we'll be presenting today uninterrupted. During the presentation, there is an option at the button on your screen to toggle the view of the presenters and presentation slides. Please feel free to use this for your viewing experience at the bottom of your screen. If you have questions, please feel free to submit them through the event chat function on the right-hand side toolbar. Please note that your question will be viewed by all participants. If you would like to ask a question privately, or if you have any technical issues whatsoever throughout this presentation and you need assistance, please use the moderator chat. You can find the moderator chat also on that right-hand side of your screen under the event chat icon. Also, feel free to submit questions throughout the presentation. We will have a Q&A session at the end of today's webinar. We will get to as many questions as we can, and we'll follow up with anyone directly if we are unable to get to your question during the webinar. Please note that this event is being recorded and will be available for viewing afterwards. If there are any issues with viewing this presentation, please note that you may refresh the browser and log back on at any time. And with that, I am excited to walk everyone through the amazing progress we've made in the 2 short years that the Michael J. Fox Foundation's State Public Policy Shop has been up and running. We've made a lot of progress and had a lot of legislative successes all across the country that we could not have done without the support of our amazing advocacy base all across the country. I'm excited to update you on those wins, some losses we had along the way as well, and the lessons that we're continuously learning as we expand. And if we can go to the next slide, please. So before we get started in talking about those legislative successes that I was just referring to, I want to give an update on the team itself. For folks who have joined us before, we have some fresh faces to the team. And for everyone new, I want to make sure that you are aware of what the Michael J. Fox Foundation's Department of Public Policy team looks like. We are growing and expanding, and we are so excited to welcome our new teammates and also review everyone's portfolios that they are responsible for. So as you can see here with this helpful organizational chart, we have Ted Thompson, who is our Senior Vice President, who has been with the Foundation now for over 7 years, and he heads up our Department of Public Policy. Underneath Ted, we have Dustin Watson, who is the Director of Federal Government Relations, Julia Pitcher, who is the Director of State Government Relations, and I will introduce in just a moment, as well as Amy Becker, who is our Director of Advocacy, our first ever Director of Advocacy that we are also so excited to have join us briefly in just a moment to talk about her new role. We also have, under Dustin, we have Sally, Mason, and Drew, who all have their own individual portfolios dealing with the federal government. We have Megan May, who is the Associate Director for Government Relations, myself under Julia as a part of our State Government Relations team. We also have Ashley as an administrative assistant. So first I want to introduce Julia Pitcher, who is the Director of State Government Relations, has been with the Foundation since the October of 2021, I believe, Julia. Correct me if I'm wrong. So I'm going to turn it over to Julia just to say a quick hello to everyone on the webinar today.
Hello, everyone. It is so great to see you all, many of you again, and so many new faces that are coming on today. It warms my heart every day to get up and do this job on behalf of the Foundation, the research that we're working on, and the community writ large across the country. Zach and I had the opportunity to travel all across the country this year to many state capitals, meet with you, join you for meetings virtually and in person, and work on key issues that are affecting Parkinson's patients in the community, and healthcare access and registries, and talk about environmental concerns. And we are so looking forward to the future and are so happy that you are joining us today. Our virtual doors are always open to talking with us and sending us your ideas, your thoughts, and how we can best serve you with resources going forward. And with that, thank you for attending. I'm so thrilled to turn this program over to Zach.
Thank you so much, Julia. Appreciate it. And I would also next like to introduce Amy Becker, who is our brand new Director of Advocacy. We are so excited to have Amy join our team as the first person into this role. We know that she is going to do great work in expanding work with our advocates all across the country. So Amy, if you would like to introduce yourself.
Yeah, of course. Thank you so much, Zach. And it's so great to see all of you virtually. I can't wait to see all of you hopefully in person in the coming months. But as Zach noted, my name is Amy Becker, and I'm the brand new first director of advocacy, hopefully not the last because of all the awesome things that we're doing. I come to the Fox Foundation from the Boys and Girls Clubs of America. And one of the huge things I love about engaging in advocacy is the passion that comes from advocates like yourself and the successes that come from us putting a face to these really important issues. So in the next coming months, I'm really going to be working to cultivate, recruit, and provide more engagement opportunities for advocates like yourselves at every level of government, because we know when we put a face to these issues, that's when we really can move the needle and really showcase how these complex issues are impacting real Americans in their everyday lives. So I always joke that the role of a director of advocacy is to make the lives of advocates easy and make it easy for you to engage. So I'm really excited to help build this advocacy program alongside all of you and give you those opportunities so we can really raise our voices on this issue and get those successes continuing into 2024 and beyond. So with that, I'll turn it over to Zach, and I'm looking forward to seeing you all soon. Thank you.
Thank you so much, Amy. As I said, we are so excited to have you on board, and we are so proud of the work of our entire team. As I said, we've been growing the team over the last few years, and we are hard at work on both the federal and the state level to help the community to the best of our abilities. And I am just excited for everyone on this webinar today to be able to reach out to us, work with us, and collaborate when possible to help further our work to find a cure for Parkinson's. If we could head to the next slide, please. All right, so the first topic we are going to be talking about today are Parkinson's research registries. And before I get into the specifics on what you see on that map there, I want to start off by painting a picture of how state government works a bit. There are nearly 165,000 pieces of legislation that are introduced in state legislatures every single year. That's an average of 3,300 per state, and the passage rate is about 20%. So when you look at those numbers, it's a bit daunting to say, this legislative bill that I care about, is it going to get done this year? The answer sometimes may be no, but it often takes several legislative cycles to get a bill passed at the end of the day. For context, each state has their own legislative body, and much like Congress, state legislatures are typically made up of a state Senate and a House of Representatives or an assembly. Each state has a governor, who is the head executive, much like the president is for the country. The governor will either sign into law or veto bills that are passed by the legislature. Most state legislatures meet anywhere from January to May or June every year, but each state has their own unique legislative calendar. Others can meet throughout the entire year, while some can have incredibly small legislative windows to get their priorities through. And now turning over to research registries. If you've joined one of our webinars in the past, you know that Parkinson's research registries has been a priority for our state team since its inception in 2021. And we often get asked, why focus on this idea of state research registries? And that is a great question. The truth is, we know that there is a lack of accurate data on incidence and prevalence of Parkinson's and other important data points that researchers are looking for to further their work into finding additional treatments and an eventual cure for Parkinson's. To begin to capture accurate data, state governments can play a key role in collecting that information on a more localized effort. Because right now, there isn't a federal priority to collect research and data on Parkinson's disease. So what we have gone ahead and tried to do is set up research registries in individual states. Much like cancer registries that exist in most states, a registry dedicated to Parkinson's disease has a lot of key purposes and benefits. Some of those include data that can help identify high-risk groups, support patient contact studies, and serve as a valuable data resource to prevent and optimally manage Parkinson's disease. We can determine incidence and prevalence of Parkinson's disease more accurately by state. It can assist researchers in studying patterns of Parkinson's disease over time. It can help determine if certain regions of a state that potentially use more pesticides have a higher incidence of Parkinson's, because the rate of incidence can also vary greatly within the borders of a state, not just across the country. It can also improve our understanding of links between Parkinson's and military service, since we know that a larger portion of our veterans community has Parkinson's when compared to the general population. At the start of this 2023 legislative session, we had 6 states that had either had registries already up and running or had recently passed legislation to create one. That you're going to see on that map in that dark orange color. So that includes states like California, Washington, and Utah out in the west, as well as West Virginia and South Carolina that were actually 2 of our legislative wins in 2022. And then you see Nebraska there that it has both a blue color and that deep orange color, because Nebraska does have a Parkinson's research registry. It was actually the first state to enact one back in 1996, and this year it passed additional legislation that I will talk about further in just a few minutes. When you're looking at this map, you can see that we targeted an aggressive amount of states for 2023. Although our state team is Julia and I, we wanted to be in as many places as possible to work on behalf of the community. So we targeted 10 states for 2023, and we are super excited to say that we had wins in multiple states this year alone. I'm going to go through each state one by one that we targeted in 2023 because it gives a clear picture of some of the wins that we had, losses, and other hurdles that we experienced. I'm going to begin with the state of Colorado. Colorado was one of our targeted states for 2023. But unfortunately, our intended Senate sponsor was unable to actually introduce the bill this year because there are often political realities that are external, whether that be budget constraints for a state or a tight legislative calendar, as I referenced earlier, that can prevent legislation from moving forward. So although we plan to target Colorado, it is not shaded in on this map because we actually didn't get the bill introduced this year. Next, I'm going to move to Hawaii, which we worked with Jerry Boster, who was the president of the Hawaii Parkinson's Association, and a bill to create a registry was introduced back in January. This isn't the first time that the bill was introduced in Hawaii, and Jerry was an amazing leader on this issue and for the community. Unfortunately, Jerry passed away last month, and he will be remembered as an incredible advocate on a local level who was incredibly spirited to helping his community to the best of his abilities. While the bill did not move forward this legislative session, if we ever engage in Hawaii in the future, we will do so with Jerry's spirit in mind. Next, I'm going to move to Maryland, which you can see is one of our wins for 2023. Maryland introduced and passed their bill this past year, and it was signed into law by Governor Wes Moore back in May. We're going to head up north next to Massachusetts, where bills have been introduced and referred to the Joint Committee on Public Health. A public hearing was held in early May that the foundation testified in support for, and the Massachusetts General Court meets throughout the year. So we do expect further movement on this bill in the coming months. But Massachusetts is one of those states where earlier I mentioned they can meet throughout the year and not just have a shorter window for several months towards the beginning of the year. So more to come on Massachusetts this year. Next, we're going to move to Missouri, which again, we had a win in Missouri this year. In early May, the General Assembly passed the bill to establish a Parkinson's Research Registry. It was delivered to Governor Mike Parson and was signed into law. And now back to Nebraska, which I mentioned was the very first state that established a Parkinson's Research Registry back in 1996. But up until now, that registry has been operating on paper, which may be hard to believe in 2023. But the truth is these registries do require proper funding in order to work to their best ability. So we knew that the Nebraska registry, as the inaugural registry for Parkinson's in the country, it needed an infusion of funding so that we could modernize that registry. And we are incredibly excited to report that $800,000 was included in this year's budget to modernize that registry in the years to come. And we are incredibly excited for the work that Nebraska will continue to lead on in the future. Next, we move to Nevada, which was introduced a bill to establish a Parkinson's Research Registry back in March, and it was a late session addition to our 2023 target states. Dr. Mindy Lokshin, who is actually going to be joining us in just a few minutes, was so integral to making this bill happen. I can't wait to talk more about how that bill came to be, but it is one of our wins for the year. Nevada passed that bill in early June unanimously, and it was sent to the governor for signature and was signed into law. Next, we move to the great state, my home state of New York. We targeted New York this year aggressively, and we were incredibly excited that the Senate unanimously passed the registry bill back in June. And unfortunately, due to time constraints with the legislative calendar, the Assembly did not take up the bill for a vote before the end of session in early June. But good news is the bill will automatically be carried over into next year's legislative session, and the team plans to continue to advocate for the bill's full passage. And we'll actually have the opportunity to speak to the lead sponsor of the Senate bill, Senator Brad Hoylman-Sigal, in just a few moments as well. Next, we move to Ohio, which, although Ohio was another state that we've worked in for multiple years now and actually had the bill successfully pass one chamber last year, it came back this year. We were able to get a provision to establish the registry added to the state's budget, and it did pass in 2023. So we are so excited that Ohio was our 5th legislative win for the 2023 legislative session. And last but not least, we have Oregon, which introduced a bill back in January. And again, due to state-specific political factors and an excessive number of bills before the specific committee that our registry bill was committed to, the bill was unable to move forward this year. But again, I want to stress that just because a bill is not able to pass on its first try or even its second try, it does not mean that the work is for nothing. It often takes several legislative sessions to get bills done. And as I've mentioned, there are political realities that sometimes interfere with your ability to get a bill done, even if you have tremendous support, bipartisan support on both sides of the aisle, amazing advocates working on the ground. There can still be hurdles that prevent a bill from moving forward. So it's important to keep that into perspective. But as we look at this map and close out our discussion on research registries, we are so excited that we had 5 wins for this year out of those 10 targeted states. So a 50% success rate is one that we are very proud of here at the foundation. And as you can see on this map, we are trying to be in as many places as we can be. So we're excited that multiple states are coming online with their registries. States like West Virginia and South Carolina that had passed theirs in 2022 are starting to get to work on establishing those registries this year. And we know that these states and these registries can provide incredibly invaluable data that researchers can tap into to, again, further treatments and eventually find a cure for Parkinson's. That's why we're here, and we know that these registries can really help that work be done. And we will now head to the next slide and talk about our next legislative agenda item, which is biomarker testing, and specifically expanding access to biomarker testing. Now, for those of you who may not be familiar, a biomarker, which is short for a biological marker, is a word used for a broad category of medical signs that can be observed and measured from outside the patient. Examples of biomarkers can include everything from blood pressure and pulse to more complex findings in laboratory tests of blood and tissue. Biomarkers differ from symptoms in that symptoms are indications of health or illness perceived by patients themselves. Over a dozen state legislatures have introduced legislation to expand healthcare coverage for biomarker tests, because biomarker tests can be incredibly important to a person's healthcare plan. If there's a suspicion that there is a specific disease that a person may be experiencing, biomarker tests can be that key to finding an answer. And we all know and hear from our community all the time of just how long it can take to get a diagnosis for Parkinson's disease. And that's the same for a lot of neurological diseases. So biomarker tests are incredibly valuable resources for folks and their healthcare plans. So states are now taking the initiative to expand healthcare coverage for those tests, because while a lot of biomarker tests are currently applicable for oncology patients, we know that there are other disease states that are coming out with biomarker tests and want people to have access to those tests. But if they're not covered by their health insurance, we know that folks may not be able to access those tests due to financial constraints and other factors. So state legislatures picked up this mantle and ran with it this year. As you can see with this map, there were so many states that introduced legislation in 2023. We were actually caught off guard by just how many states were bringing this online and knew that this was an issue that would be incredibly helpful to our community once a biomarker test becomes available. More to come shortly on that. And just important in general when we talk about healthcare coverage and the things that are important to patients that healthcare can cover. So you see here on this map, we have the deep orange color that indicates states that passed legislation to expand access to biomarker testing in 2023. And the states shaded in navy blue are states that introduced legislation in 2023, and either those bills were not able to get done due to time constraints of the legislative calendar, or in a state like California that is still debating that bill today. And that takes us to our exciting news at the foundation when it comes to biomarkers, which honestly was completely coincidental for the state team here. We did not know that the amazing groundbreaking news from our PPMI study was going to be announced in April, which is that researchers discovered a new biomarker tool for Parkinson's for the very first time. It is referred to as alpha-synuclein, known as the Parkinson's protein, in brain and body cells. And the test is capable of objectively and reliably detecting the disease at the molecular level, even before the onset of symptoms. So when we think about patients and their diagnosis journey, a biomarker test like this could be an incredible breakthrough to break through the multiple tests and multiple screening tools that are presently available and have a singular test that can really detect Parkinson's at a much earlier point. So while we know that there is still a lot of work to be done to make this newly discovered biomarker available to individuals and approval by the FDA and all those other regulations, we know that when the time comes that this biomarker test is available, we want as many people as possible to have access to it. We want it to be covered by folks, the healthcare plans that folks have across the country. So that is why we are engaging on this issue now. It's a forward-thinking agenda. We know that one day this test will be available for folks, and we want them to have access to it and have healthcare plans in states be mandated to cover these biomarker tests whenever doctors think that that test is necessary for that particular patient. So we expect a lot more work on biomarkers in years to come. We are excited to be engaged on this issue, and we hope that our community is as well, given the incredible breakthroughs that we have seen in this past year and for the work to come in the future. And as we move now to the next slide, we'll touch upon our final legislative priority for 2023, which was protecting against genetic testing discrimination. Now, genetic tests can provide helpful information for patients as they make life decisions, including securing specific insurance policies for both themselves and their families. We've heard from so many people in the community about difficult decisions that have to be made after they receive their diagnosis. I often think about a conversation I had with one individual this past year who was telling me about her decision of whether to take a long-desired family vacation sooner than they originally planned because she wasn't sure if her symptoms would prevent her from doing so in the future. We know that those difficult decisions extend to people living with Parkinson's as it pertains to their healthcare choices, as well as it pertains to their insurance choices. So when we talk about discrimination using genetic testing, there is the Genetic Information Non-Discrimination Act. That is a federal law that has been in effect for over a decade now that prohibits health insurers from using information learned through genetic testing, such as a gene mutation linked to neurological disorders, to deny healthcare coverage or engage in price discrimination. So on the federal level, there are protections to prevent the denial of healthcare coverage or increase the price of premiums based on genetic tests. However, there is a pesky loophole here. Those protections do not extend to life insurance, long-term care insurance, or disability insurance coverage. And we know for the Parkinson's community, all of those different types of insurances are incredibly important to people living with Parkinson's and their families. So that is what this map is detailing here as the start of what we hope will be a trend across the country in legislative sessions moving forward, which is introducing bills that seek to protect genetic testing discrimination for those additional types of insurance coverage. There were bills introduced in several states this past year, and as you can see, only one got a bill across the finish line, which was the state of Tennessee. And Tennessee's language was specifically referring to life insurance. So protections were extended against price discrimination or denial of coverage for life insurance in the state of Tennessee, which gets to talking about the importance of legislative text. These states can go about expanding these protections as broadly as they want to, but that is dictated by the text of a piece of legislation. So for Tennessee, while they did extend those protections for life insurance, that still leaves long-term care insurance and disability insurance coverage left out of that particular bill. Each state approached this differently this year. We saw states that attempted to expand protections for all three of those types of insurance coverage, and we saw states that only picked maybe one or two out of those three types of coverage. So we plan to continue to advocate on behalf of the community on this issue because we know that those types of insurance protections and coverages are so important to the community. And we want to make sure that federal protections against denying healthcare coverage or engaging in price discrimination are extended to life, long-term care, and disability insurance moving forward. And we will move on to the next slide, which I am incredibly excited about because this is going to be the next section of today's webinar where we are joined by incredibly special guests today. And before I introduce our guests, I do want to point out that at this time, we are going to be adding two polls to the poll toggle to the right-hand side of your screen where all of those chat icons are. You will see an icon for the polls as well. And we're going to submit two of them now, one being if you know your state representative, whether that be a delegate or an assembly person or your state senator, a simple yes or no on that one, as well as have you ever contacted your elected representatives about a specific piece of legislation, another yes or no question. So you can vote on those polls and we will review the results momentarily. But now I would like to welcome our two special guest speakers for today's webinar. Up first, we have Senator Brad Hoylman Siegel from the great state of New York. The senator was first elected to the state Senate in 2012, and in the Senate, he serves as the chair of the Senate Judiciary Committee and has championed and passed major pieces of legislation, including the Child Victims Act and the Gender Expression Non-Discrimination Act. He is also a leader on everything from protecting LGBTQ+ rights to ensuring pedestrian safety on New York streets and roadways. Welcome, Senator.
Good to see you. Thank you so much, Zach. This is so impressive that you and your colleagues have launched this effort nationwide, and the benefits that are going to accrue to the survivors of Parkinson's and future generations who may grapple with this debilitating disease are innumerable. So I can't thank you enough for everything that you're doing and the expertise that you're bringing to this issue. I'm very proud that in New York, as you did mention, we were able to pass for the first time our Parkinson's disease registry bill at its first outing. And that's a big deal because those of you who work in state legislatures know how difficult it is to move a bill. And we passed it through the state Senate unanimously. And part of the reason that we did that, I'd like to think my talented team, Maya Burlow, my legislative director, had something to do with it. But a lot has to do with you and your team and your persistence in Albany, actually coming up to the state capitol, speaking to my colleagues and sharing stories. So many of my colleagues have friends and family members who have Parkinson's, and it's not surprising because it's a disease that impacts 1 million Americans and more than 65,000 New Yorkers. So it would follow that many of my colleagues would have an understanding of the condition as it is now. And while we know that doctors have been studying Parkinson's for decades, we know that there's so much unknown about it because we don't have the data. We still don't know why veterans have a higher rate of Parkinson's than the general population, or why men are twice as likely to get PD compared to women, or why Parkinson's is more prevalent in some states rather than others, or why Parkinson's prevalence has doubled over the past 25 years. And yes, environmental factors might be a consideration. We know also that 1.6 million Americans will live with Parkinson's by 2037, yet we still lack any treatment to stop, slow, or reverse its progression, much less a cure. So we have to know more. So I'm extremely honored to work with the Michael J. Fox Foundation for Parkinson's Research on this legislation and establish a Parkinson's disease registry in the state of New York. We passed this legislation in the state Senate on May 30th unanimously, 61-0, Republicans and Democrats joining in this effort. That's not terribly common these days, whether it's at the federal level or at the state level, but it happened here. And disease registries are special databases that will be able to collect information about patients with these conditions in order to aggregate the data for national research and more accurately determine the prevalence of the disease and identify high-risk groups and environmental factors. And that's important in New York because we have such a diverse population in places like New York City, which is going to add a lot of information to this effort. Here in New York, we've had a cancer registry that is one of the oldest in the country and has been collecting information about the incidence of that disease for close to 80 years. Modern cancer research relies on these registries to discover demographic and geographic patterns and who contracts cancers and discoveries that have quite literally saved lives. So I'm hopeful that New York will join other states that you have mentioned, California, Maryland, Nebraska, South Carolina, Utah, Washington, West Virginia, in establishing a statewide registry. All the information collected about patients is going to be confidential, and anyone would have the ability to opt out if they choose. And the data is going to be collected and shared with the CDC and combined with information from other states for national level studies. And this legislation just isn't the right thing to do. It is the fiscally responsible thing to do. According to your research at the Michael J. Fox Foundation, the indirect and direct costs of caring for New Yorkers with Parkinson's, this is just New Yorkers, totals $3.3 billion annually. And since Parkinson's is the fastest growing and second most common neurological disease in the entire country, those costs are only expected to rise. So understanding this disease is the key to finding a treatment and the key to finding a cure and saving lives. There have been promising treatments that you have mentioned, which have just broken over the last few months. And I'm thrilled that New York may be a part of those efforts to gain FDA approval of new treatments. And I also want to add that we share your concern about protections against genetic testing discrimination. And I've introduced legislation that's going to prohibit insurance companies from discrimination based on genetic predisposition. So if your insurance company discriminates against you, you are significantly less likely to get the genetic testing that could be life-saving, whether it's Parkinson's or cancer or other conditions. So again, want to reiterate my gratitude to the Michael J. Fox Foundation for being stellar advocates, persistent, present, and committed to saving lives and really ramping up this effort in such a short time. You are really fighting the fight for people living with PD nationwide, and I'm so grateful for your advocacy here in the state of New York. Thank you so much again.
Thank you, Senator. Thank you for all of those words and for giving such a great overview of where we're at currently in New York with legislation. And you are so right. Persistence is the key here. So we are going to continue to advocate, not just in the state of New York, but all across the country on all of the issues, registries, biomarkers, genetic testing protections that you just mentioned. So thank you so much for those words and for speaking directly to our community today. I also want to bring in Dr. Mindy Lockshin. Dr. Lockshin is the chair of the Parkinson Support Center of Northern Nevada. The center was first founded in 2021 during the peak of the COVID-19 pandemic as a nonprofit organization that's dedicated to providing access to care, education, and social assistance to the estimated 5,000 patients affected by Parkinson's in Northern Nevada alone. Dr. Lakshan was also the catalyst for legislation to establish a Parkinson's registry in Nevada in 2023, and I want to welcome Dr. Lakshan today to this webinar. Thank you, Dr. Lakshan, for being here.
Thank you, Zach. I am just honored to be part of this panel, and the senator from New York certainly summarized an enormous amount of information that is so important for us to consider when working on legislation. I've got to say, I got involved, as you said in your introduction, we kind of jumped in late in our effort in Nevada. It stemmed from my working with Dustin at the Michael J. Fox Foundation, working on the national level, advocating for the National Plan to End Parkinson's Act. And it made me think, gee, what is happening at the state level? And of course, then it was November, election time, holidays, and I reached out to Julia, who said, wow, we really want some statewide registries. And that got me thinking. My master's in public health made me realize data is so critical and so necessary for showing the need for so many different kinds of resources. We need data showing the need for more movement disorder specialists, more just generally trained neurologists. It's been said that Nevada is not just a desert, but a neurology desert. We are really short on all kinds of physicians, but definitely trained neurologists who understand movement disorders. And I was very fortunate in, this is a small state. Reno's known as the biggest little city. I knew a state senator from Las Vegas who grew up in Reno, Senator Scheibel, who second term, extremely experienced, extremely knowledgeable, had one bill left to be able to enter. And her father has Parkinson's, and I knew that too. So she had the skill, the talent, the connections, and the passion to really help spearhead this effort. And yes, we're incredibly proud that from time of introduction of bill to unanimous passage in the Assembly and the Senate and signing by the governor was just a matter of months with tremendous support statewide.
Right. And Dr. Lakshan, I have to say, when you first reached out to us and, told us about your personal connection to the state senator and to just the drive that you had about this idea and bringing it to the state of Nevada, I could not have been more impressed by your tenacity. And it goes to show how one person can really spark that idea in any state across the country, in any legislature, because there are so many folks out there who don't necessarily know where to start or how to get involved, how to advocate on an issue. So what would you say to folks who may feel intimidated by that process or who have never advocated on behalf of an issue before? What would you say to them to alleviate some of those concerns and fears that they may have?
For me, the biggest part is finding the team. And yes, Zach, you and Julia were immensely important in providing language, support, ideas, concepts to run with. And then it's really just reaching out and saying, hey, is there anybody at the local university who's interested in doing this kind of research? Well, there wasn't at the local university here, but we were able to partner with the UNLV Brain Health Department, phenomenal department, super excited about studying biomarkers of all kinds, and in housing a registry, because that's the next step, not just the idea, but where is it going to be housed? How is it going to be secure? So the big part is just having that passion and then talking to as many people as you can. And one person will lead you to another, will lead you to another, and that person will have the skills and talent to run even further, like a relay team, and make it work.
That's right. And it's so important. It is such a team effort, and it takes a village to move legislation and to advocate on behalf of the community. It's advocates, it's organizations, it's folks on the ground in a state. And we could not be more proud to partner with you, Dr. Lakshan. Thank you so much for joining us today to talk about Nevada and the amazing work that was done this year. Kudos to you, and we know that you are doing great work in Nevada for the community. So just thank you so much for your time.
Thank you. And if anybody wants to reach out to me for advice on another state, perhaps a small state, because that's really what I understand better, I'm more than happy to talk to them.
Thank you, Dr. Lakshan. All right, and before we move on, I do want to note the poll results that we had when it came to knowing who your state representative is. It looks like we had about 63% of folks say yes. And when it came to contacting an elected representative, 83% of you said yes, which is such an exciting number. I am so happy to see that many folks engaged in this process and speaking to their elected officials, because it is so important to always remember that they work for you and want to hear from you about issues that are important to you and your families. So those are great numbers, and leads us into our next slide, where we are going to move through these next two slides a bit quickly so that we can get to all the questions that I know are coming in. But this next slide here is going to be talking about here we are, using your voice. An incredibly exciting premise, because we cannot do any of our work when it comes to working on these bills without our advocates, without the support of the community. And I want everyone to take note to the words on this slide. Advocacy is not a one-size-fits-all action. There are many ways to get involved on advocating for the community, and we've listed some of them here. Some of them folks on this call may have engaged with before, and maybe some are an idea that you haven't thought about but could see yourself doing. And that goes from everything from contacting your elected representatives, which 83% of you have done, and I'm so proud of each and every one of you, to things that go even beyond what some folks may think that they are capable of, which includes testifying at a bill hearing. We've had amazing advocates working on bills, not just across the country, but as earlier mentioned, the National Plan to End Parkinson's Act. We've had folks testify in front of Congress, testify in front of their state legislatures on behalf of bills for the Parkinson's community. We have folks participating in action alerts, whether that be sending emails to their elected representatives, whether that be calling to the office directly to advocate on behalf of a bill. And there's also the option to attend in-person advocacy events, which we are hoping to engage more on in the future. Obviously, we've had several strange years with the pandemic affecting those types of events, but they are coming back, and we are excited to speak with folks who are looking for those opportunities to really be out there in person and advocate on behalf of the community. So there are many ways to advocate. Not all look the same for each person. It's important to remember that, because using your voice in whatever way feels comfortable to you is valuable. And we want everyone on this call to take that away with them today. And as we move to our final slide, we are going to be talking about some resources that we have available to advocates. Some of these folks may be familiar with, others are up and coming and more to be developed in 2024, now that we have our Director of Advocacy, Amy, that you heard from earlier. And I believe and know that my colleague Julia has entered the Action Center into the chat today, but our Action Center is there for our advocates. It takes you through several different options where you can share your personal story with Parkinson's. You can access a relationship mapping tool that can tell our team whether you have relationships connected to elected officials or others dealing in the Parkinson's space. We have available one-pagers, toolkits, and other messaging documents that can help you speak to your elected officials. We are adding more and more of those on and update them frequently as we make progress on some of our legislative priorities. And coming in 2024, we will have advocacy in a box, because we are trying to make this process as straightforward as possible. We know that individuals reach out to us all the time looking to get involved, looking to really get themselves in a position where they can advocate on behalf of the community, where they can do more of this work. So we are going to be working on making that as seamless as possible, on having toolkits and trainings available on our website for advocates to check in on whenever they are ready to. Because while we enjoy so much connecting with our community on webinars like this and being able to talk about issues, we know that sometimes folks may just be having a particular day where they're at home and they say, I want to get involved. What do I do first? So we want those resources to be available on our website for our community at any time. And we plan to make that more accessible in 2024 and add a lot to our Action Center that will bring more folks into the fold and doing amazing advocacy work across the country. So with that, I know this was a lot of information for about 50 minutes now, but I want to make sure we have time to get to our questions. So as we move to our final slide, I want to bring back in my colleague, Julia Pitcher, and I want to say to everybody on the webinar today, just thank you for being here. Thank you for your time and your attention. I know that we have questions in our chat, and we are so excited to get to as many as we can and answer directly to the community about what you want to see us working on, questions about what we've done this past year, and what we see to come in the future. So Julia, welcome back. I am excited to hear from all the folks that we have here today and answer some of their questions.
So one of our questions comes from our friend Fred, and he's asked, the toolkit sounds great, but how will we coordinate on the state level if each person is doing their own thing? And that is such an excellent way to open up how state advocacy works. We are not a chapter-based organization, so we do not have individual state chapters, but we do coordinate with many of our friends through the United Parkinson's Advisory Council, local groups, and also Parkinson's Foundation and APDA. We also now have Amy as our Director of Advocacy. So having your information put into our system and us being able to coordinate geo-target states, and our goal is to come up with like team leaders or state leaders as we go forward in being more active in states. So if somebody like Fred would like to say, I'm going to take on my state and then help us be a point person for when we send out resources or coordinating witness testimony, things like that. But we also want to empower you to use your voice yourself because, you know, we can't be in every single meeting and we want you to get to know your lawmakers. You know your lawmakers from meeting them in the grocery store. Maybe you go to the same church or your kids attend the same school. Ask them to go to coffee or ask them to meet you online. I'll never forget working with Kevin out in Oregon when he met with his first lawmaker together. We did it online because I couldn't be out there 3,000 miles away at the time. And we had an absolute blast, and he got to know so many of his local reps that way. And then they can call him and say, hey, what are we working on? Or do you have resources? And then Zach and I can email Kevin what the new talking points are, et cetera. One of the things that we're working on is making sure that our resources are incredibly easy to download, print, and email. And as Amy said, we're going to be updating those for each year, so you can still use what's currently on the Action Center that has our priorities. It has lists of session dates when your state goes in and out of session, and how to talk to lawmakers. And we are happy to engage in more training webinars later this year. Somebody earlier also asked about elections. We're going to be rolling that out. And so I'll end that question there. And if Zach has anything to add, I'll jump back into the chat to answer more.
Yeah, no, that was all. I 100% agree, Julia. That was a great response there. And we do have our next question from Beth Carter. Julia, do the registries follow where individuals have lived for a while? While Beth's father was a long-term resident of Maryland, he grew up on well water in the Rust Belt. So are these registries capable of factoring in when folks move from state to state and whether their diagnosis will be picked up from one registry potentially to another?
This is a great question, and I'm going to give my lawyer answer. It depends. Most states at this point in time, because the registry concept is new, that there's not yet interstate operability. So if you move and you move with your driver's license to another state, that the Maryland driver's license, DMV will know that you've transferred elsewhere, and they will deactivate your Maryland license and start a Kentucky, license. At this point in time, what we do have is that on a yearly basis, the registries are going to have their data reviewed, and they will be cross-referenced with vital statistics. We will know on death records, but we may not know if somebody has recently moved. A long-term goal is to coordinate among states, which is also possible with things like health information exchanges. Those are hubs that have been created, data hubs in states, and that there are multi-state consortiums that have started for data hubs because there are folks that live in Pennsylvania, come to Maryland for healthcare, and go back and forth. And so we do think that that will be on the horizon, following folks for quite a while. And Beth, I'd also like to have you reach out to us individually. This sounds like your father has a really interesting story of growing up on Wellwater and the Rust Belt. We would love to hear more about that as we are gathering in our story drives. And I think the email address is in the chat.
Thank you, Julia. Let's see, I think we also have a question here from Natalie Watkins, specifically about the biomarker and our exciting news there. Natalie asks, what is the plan for when the test will be available? As treatments are mostly geared at treating symptoms, what will knowing you have the biomarker do for a patient? That it is a great question, Julia. I do want to say that the biomarker test is speaking to the availability. These things do take time. It was an incredible breakthrough that a biomarker was first identified. That is step one. But there is a regulatory process and a rollout to make this test available to the public that can vary in terms of how long that will. So, of course, we'll continue to work and speak to our community about any further developments when it comes to the biomarker that has been identified. So there is more to come on that. Obviously, the work is continuing, and we, of course, will work to get that done as soon as possible. But these things do take time. So that is important to point out, and also speaks to our work on biomarkers legislatively, because as I said, when that day does come that test is readily available, we want to make sure that healthcare plans are covering it for individuals to seek out. And Julia, in terms of the second part of Natalie's question, treatments are mostly geared at treating symptoms. What will knowing that you have that biomarker do for a patient?
Thanks for kicking that over. So what is beneficial, and particularly I'm going to say in the cancer community, because they've had some biomarkers that have been on the market and available for much longer, and ours is just purely in the discovery stage right now. We know it exists, and we still have to do more testing on it. We also have to change some of the applications of how it's working. It's right now a spinal fluid test, hoping to move it to more of a blood test in the future, and then get it FDA approved and into commercial markets. What it does is it assists in personalized medicine. So knowing that you are high risk or are at early signs without any visible signs really helps people plan for best treatment options or financial decisions, but also mainly on your medical decisions. Being able to know the best treatments, again, I'm going to relate it back to cancer because they have been working in this space for much longer, that there are certain types of chemotherapy and other therapies that work better for certain cancers. And if you can target that and then the genetic component to that, you can, have a better quality of that treatment program going forward. And that's truly what personalized medicine really is going forward. We have so much in the biologic pipeline, and really making sure that it's not just what I call the Oreo sleeves. When you think of a box of Oreos, they are all the same. But when you're thinking of biologics and biomarkers and things that are more precise, you're really thinking about something like grandma's chocolate chip cookie recipe. Your grandma's chocolate chip cookie recipe is going to be much different than mine. And that's why we tier medicine and protocols towards each patient individually. I'm going to hit another question that I saw pop through is, will the policy forum be held again? And with Hilde, so much has changed since COVID, and so much is more available online. And then also in Congress, when it came to federal Hill days, Congress was shut down after the insurrection in 2021. So there was no availability for advocates or staff like us to actually go onto the Hill and have these individual meetings for quite a while. So we are hoping that we are going to be developing some type of either local or regional fly-ins for states, local or regional, additional fly-ins. And we've got some big plans in the work. Give Amy just a little bit of time. She's just hit her 1 month mark here at the Fox Foundation. And let me tell you, she has some incredibly big ideas. So I do think we're going to bring something back in the future, but it will be new and fresh. And we also want to hear your ideas, because we want to know what you want and what you think you'd like to see going forward and what works best for our community, because we don't want to plan something and then have nobody show up. So thank you for that question.
That is very true, Julia. And we do hear from our community often, and everyone who does reach out to us always inspires us in terms of ideas, in terms of planning, in terms of legislative priorities. So it is so important to hear from our community. That's why we do the webinars like today's. It's why we try to have as many events, whether they be virtual, in person, or those action alerts, to engage with the community, to get that feedback, to hear from folks. And we look forward to continuing that into 2024 and with the work that Amy has to come. We are so excited.
I'm going to answer Michael's question real quick before we hit the top of the hour. Michael asks, are biomarkers part of the state registry or more of an overall national plans in terms of Medicare participants? So you got a lot of questions there, which I actually think is so great to parse out. So they are not part of the registry. So registries pull patient population data, such as name, address, gender, date of diagnosis, other comorbidities, et cetera. It's more basic medical information that is used for aggregating on incidence and prevalence in states and figuring out where folks are. It's de-identified, so your information is not going out to the public. It's just more so folks, we can figure out where is Parkinson's occurring and why, and the numbers. And then the idea is to drive research in state with local universities and ultimately larger research across the globe with that data. Biomarkers is part of a early diagnostic test that helps with clinical standards in producing what the treatment plan shall be, or ways of other markers that need to be aware of for as you are progressing either with symptoms or non-symptoms at the time. So at this time, I can't talk to will it be part of Medicare down the road, because it isn't actually something that's commercially available or FDA approved at this time. And then when it comes to the national plan, I would say it's all involved. We want our federal government to partner with the people that need to be in the room and come up with a plan and work on this together. It's a nonpartisan, way of going forward together with the right folks in the room, the right scientists, and making the government pay attention to Parkinson's going forward. And we're so thrilled that this bill is going in Congress right now so far. And I know that you all have been working with our team on that. And so hopefully that answers that very, very astute, complicated question, because it is all together, but will be parsed out separately when it comes to state and federal legislation.
Thank you, Julia. I thought that was a great answer. So we are coming up on time. It is just after 1 o'clock here on the East Coast. So I want to begin wrapping us up by just, again, thanking everybody for being here today. Your enthusiasm and your interest in the work is so critically important. To anyone who had further questions, you can reach out at any time at policy@michaeljfox.org. And any questions that are in this chat that we weren't able to get to, we will follow up. But again, thank you for your time. Thank you for your attention. I want to say a special thank you to everyone on our team, Julia, Amy for joining us, as well as our marketing and communications team for helping us put this together. It is a team effort, not just for the foundation, but for work for the community at large. So I want to thank everybody for their incredible work, and we are so excited to continue engaging in the years to come because there is much work still to be done. So thank you so much, everyone, for being here. The recording will be available shortly, and I hope you have a great day wherever you are across the country, and thank you so much again for joining.